Hello, everyone. Thank you for joining. And I am Shannon Ho. I am a postdoctoral fellow working at the Neurorehabilitation Psychology Service here at KU on the Rehabilitation Unit. And I do see a lot of stroke patients as well on the unit. Just wanted to share a bit more about the mood changes and the importance to kind of identify some of those things early on as well and what we can do with those things. And a bit of an overview of what we will go over today. We'll kind of briefly touch on generally what stroke does to us and what that may impact our mood. And I'll go over a few of the common mood changes that people may experience. One is called adjustment reaction, one is depression, and one is anxiety. And I also want to touch a bit on what we can do when we notice those changes, or even what we can do before we notice any changes that can help for just coping. And lastly, I wanted to touch on resilience, which are more that are positive changes in mood that can help us through any changes that we observe that happens after stroke as well. All right, so to start, I wanted to first talk about what stroke means. Now, what stroke in terms of definition is a cerebrovascular accident. It's a brain attack that can cause changes in your body and your emotions. So usually part of the blood flow to an area of the brain is cut off. And so what that means is then your brain cells don't get the oxygen it needs, and some cells begin to die. Now, what that means then is that the abilities controlled by that area of the brain, which may include memory or muscle control or language, really depends on where that area is that happened, where the stroke happened. And that can impact your body in different ways. Now, it can occur to anyone at any time, and depending on where the stroke occurs and how much the brain is damaged, people may experience different things. For example, a small stroke may only have minor problems such as more like temporary weakness of an arm or leg, while other people may have more of more permanently paralyzed on one side of their body, or even have difficulties with communicating, whether that's because of the physical ability or difference in understanding language or difference in expressing language as well. So a lot of variety in how it impacts people. And some people recover completely from stroke, but more than 2/3 of survivors will have some type of changes that stay on. Now, so as we can already picture with all these changes, there's a lot that goes into more of how we cope and potentially how we react emotionally to the change. And this is more of some statistical data or information in terms of how often stroke can happen or how prevalent it is in our world. The statistics can look a bit scary when you look at it, like it occurs every 40 seconds. It is the 5th leading cause of death in the US. And you can see that a lot of people do have these experiences. And with how often or how much it happens, we really want to know first how to prevent this from happening? What can help us? And the other thing is, what can we do when we do notice changes that we're coping with? What can we do in terms of helping with our mood? This is more of a information page of how much it happens. And then now I want to focus more on of the psychological concerns, or how it really impacts us from the day to day. So as you can imagine already, having a stroke with what I described, how it happened to your brain and how it can impact different areas of your life, it is a life-altering experience. And so it's common to have worries about what the future will look like, especially at the beginning of recovery stage. And some of the stroke survivors may even feel like a loss of their former self, feeling like a lot of that identity is changed. And that can be a big impact. And some people may even feel a sense of diminished self-worth, feeling like a lot of the activities that define them, a lot of the identities that define them are different now, and what that means for them as they process through that. And also, there may be this sense of losing trust in their own abilities, as when the stroke happens, a lot of people may feel like, in a sense, it's like your body kind of betrayed you in a sense. And a lot of times there's this sense of disconnect that can come up. And as we talk about these thoughts process, or these things that come up for people, you can imagine a lot of the emotions can come up, including anxiety about what your body can do now, including maybe low mood about the coping with the changes of identity or changes with how you view yourself, and those can come up. And the other thing I wanted to point out is that the age at that you have the stroke can predict psychological and social function. Some younger folks may have more ability in the brain plasticity, which means ability for changes in the brain where they can increase functioning in specific other areas of the brain to compensate for the change. And usually at 12 months post-stroke, it can be a big predictor of functioning for the next 5 years. Now, I wanted to talk a bit more about additional risks for mood. We already kind of touched on the changes that are happening and how even with that, there's a lot of difficulties or changes that you can expect in terms of mood that can come up with those identity change or thinking about adjusting back to your life routine. But even in addition to that, there are additional risks that are found for depression and anxiety that's common after stroke. And we can see that for depression, it has been reported that up to 33% of stroke survivors do experience depression post-stroke. And sorry, I could not find the data for the anxiety, but it is also highly correlated with stroke as well. And mood and emotions, people find that they tend to be more sensitive, or some people may describe that emotions come to them more easier than before. And like they might laugh or cry or get mad more easily than compared to before the stroke. And these changes are not only because of the emotional reaction to the stroke. There are studies that tell us that there are changes in the chemicals in the brain too that actually then also associate with this increase in depression or anxiety that people may experience. And some of the other things that even predict more of this potential depression or mood changes, anxiety, or if you've had previous experience or concern with mood before, like history of depression, history of anxiety, and or if you've had previous stroke, or even the cognitive changes or changes in thinking and attention and memory, those can impact how you feel more easily as well. And so what that means for stroke survivors is that a lot of times it really interfere with, even though as much as we want to engage in rehabilitation programs, as much as we want to maintain a lifestyle that consists of good exercise and healthy diet, a lot of times if we are experiencing depression and anxiety, that can come in the way of that. For example, with depression, a lot of times people can feel more low and feeling like it's really hard to get up and start going and to do things, and that can impact how much activity level we can engage in. And for example, the fatigue that we feel, not only because of the physical part, but the emotional part can also come in the way of having that engagement level that we want, and activity level, and managing diet, and going to outpatient therapies. So it is a very important area to really talk about and to notice as well. And so it is important to notice them as early as possible if you are experiencing some of those changes. Now, although stroke may increase risk for depression and anxiety, I want to mention that not all people experience it. And my intention of presenting this information to everyone, regardless of whether people have concerns about low mood or anxiety, is to equip you with tools to recognize if the mood problems become something that you are experiencing, or if someone you know in the future may experience it, and be able to intervene early on. Now, before I even start to talk about the mood changes, I want to touch on what normal mood looks like. Now, it's normal to have ups and downs. It's healthy to have ups and downs because that's who we are as human. I kind of like to see it as like the weather of the sky. Like you can have winter, you can have rain, you can have summer, you can have sun. It changes from time to time, and that is normal. And with adjusting and coping to changes, it's okay to have good days and bad days. Those are normal mood changes that can happen. And there's no right way of reacting to stroke and its effect on your life. Everyone reacts differently to it. And along with it, there are those ups and downs. Now, what I'm going to talk about more in terms of the changes is when these ups and downs stay on for a little longer, and that start to make it feel like it's really hard to get to the goals and things that you want to do in life. And that's when we want to really come back and take a closer look at it. Now, I want to start with talking about adjustment disorder or adjustment reaction to changes. Now, what that looks like in terms of the clinical definition is that when the emotional or behavioral symptoms that's developed from as a response to the changes in your life that's stressful and stays on about 3 months or shorter than that. Now, some of the symptoms people may experience may include feeling distress that that is usually the reaction it feels like bigger than your usual reaction to stressors in life. And it kind of comes in the way of you being able to connect to people. It comes in the way of being able to do what you want to do. And it's some of the symptoms may include, which we'll kind of talk about more in more depression too, but some of the mood symptoms are similar with depression, but just feeling low, feeling like you're not having much interest in engaging in things that you usually feel like engaging. And there can be changes in appetite, changes in weight that just seems kind of out of the ordinary for you. Changes in sleep. Some people may sleep a lot more than usual, feeling like they're more easily fatigued, while some other people may have a hard time falling asleep as well. So some of those emotional response, the low mood, the loss of interest, and the physical responses as well. But I want to clarify for the adjustment disorder part of it, a lot of these emotional response and changes are going to be 3 months or shorter. Now, when it is a longer term response that feels more prevalent for people, then we come to this area of post-stroke depression. And it is actually the most common post-stroke mood disorder. You can see 20 to 30% of people experience post-stroke depression. And I've described a bit of that mood earlier, but it's more than just feeling down or blue, but it's more of this feeling depressed and low every day or nearly every day for at least 2 weeks at a time, where it can feel like this heaviness that just is really hard to lift. And during that period, you'll have a hard time feeling motivated to do things, or feeling like you want to engage in things, and you lose interest in activities. You have changes, like I said earlier, in appetite or weight, problems with sleep, and you'll also feel more lethargic at times. Like it's really kind of, you feel like speaking or moving wise, you're just kind of slower than usual. And there's that fatigue piece, lack of energy, and even feeling low about yourself, having thoughts that come up about that, and difficulty with concentrating or focusing on things. So that's a lot of usually what people feel with depression. And it can develop right after stroke, or it can be a bit later on in recovery as you're trying to get back to some of the things that you're used to doing too. And like I said before, it can be caused by the stroke, more of that neurological or chemical change in the brain. And it can also be this reaction to the changes of how you see things, how you do things, how you identify with yourself, or it could be both. Now, typically, when we are talking about post-stroke depression, we can treat it with medication or psychotherapy or a combination of both. But I'll come back to talking about treatment a bit later too. Now, this is more of that continuation of how we diagnose clinically depression, because clinical depression is different than just feeling blue or the normal ups and downs that we talked about at the beginning. Now, when it is more what we call the clinical depression, it is when this is really interfering with your day-to-day, and it's this pervasive or prevalent part of your life that really feels like it's hard to lift. And usually we want to make sure there's no no other medical condition that could cause that fatigue or difficulty with concentration, which actually later I'll talk about too, because there's a lot of symptoms here that could feel like an overlap of people's experience. And I want to spend some time talking about that too. Oops. Oh, and here are what I was talking about in terms of the common symptoms that people may experience when they experience depression. And usually if you have 5 or more of these in a 2 weeks period of time, then it is more pervasive for you. But I want to take a note that it's good to recognize these symptoms, but in terms of the diagnosis, I want to make sure that it's more, you can notice some of these changes and bring it back to your healthcare provider and not self-diagnose yourself, because like I said, there can be normal mood changes, or there can be more of the short-term stress response that we have from adjustment disorder or adjustment reaction. So we really want to make sure we are not just diagnosing ourselves in that way too, but more so noticing the symptoms and bringing it up with our healthcare provider if we have concerns. Now I want to talk a little bit about the overlap of symptoms. As you may have noticed as we were discussing about the symptoms, some of them are really similar to the experience, the common experience of stroke and post-stroke recovery, like fatigue, and some flat affect may be what people experience too, loss of interest in things, restlessness, irritability, anxiety, memory, like a lot of those things. It can be a part of emotional pathway where it's emotionally impacted that make us feel that way, or it can be a physical symptom from stroke. And sometimes it's not so clear cut either, where sometimes one can impact the other. If our stroke reaction with the fatigue, and it's really hard to get into some of the activities we're used to doing, that can impact our mood. And we might have that loss of interest in activities that come up, and it kind of goes in that cycle where it could start from stroke, it could start from depression, but it kind of interact with each other, and that's another possibility too. But another reason that I really encourage, if people notice symptoms, to always go to the healthcare provider to talk about these, is because though they are the expert to notice if this is more an emotional depression or clinical depression versus it could be more of that stroke reaction too. And the people in the healthcare profession then can identify or tease those apart easier. But I want to mention that there is that overlap that is there. Actually, a lot of them too. So like I said, it's good to talk with your healthcare provider about any symptoms that you may be experiencing if you are concerned. So that's more with the depression piece. And I also wanted to talk about the anxiety piece. Now, anxiety can often coexist with depression. And a lot of times it can create this uncomfortable feeling of worry or fear with your physical symptoms. Some people may feel more kind of watchful or alert of like if there are changes in their body after stroke. And sometimes that can actually get into the way of your engagement in things too. And for example, if you notice, or if you, like I mentioned earlier, like that feeling of distrust to your own body at times, like if you have that anxiety that comes up about whether you can walk without falling, or some of that physical aspect of things that the anxiety can make it hard to continue engaging in some of that therapies if you have that fear of falling, for example. So you can see that feelings of anxiety can at times get into the way of your engagement in things as well. Now, I again want to say that this anxiety can fall on a spectrum, and there is the normal anxiety too, which usually help us with planning, right? If we are having worries or anxiety, sometimes that help motivate us towards doing things. Sometimes that help us towards planning. It helps us towards making sure that we are putting things on the agenda and problem solving through it. So that's why anxiety exists, because to an extent, it helps us keep track of things. Now, it's more when the anxiety comes to the point that it's really hard for us to engage in things. It's really hard for us to feel connected to things because everything starts to feel very overwhelming. That's when it comes to that more excessive part or increased anxiety than normal, where you can have more uncontrollable feelings of worry, and it impacts you in a way that makes it hard to go through the day-to-day. And I will talk a little bit about the symptoms that people may notice with anxiety too. Clinically, what we call generalized anxiety disorder is when you have excessive anxiety and worry, and it can occur for at least 6 months, where you have experience of maybe difficulty controlling your worries, like feeling like you get stuck with them more. Like you can have normal worries or worries that when you think of it, it's really hard to do anything else. You kind of feel stuck with it. Or you can start to feel a bit restless, like some people may fidget more and move around a lot more. It's really hard to stay still. It feels like they always want to be moving, feeling restless, and they could feel easily fatigued or have a hard time concentrating, or experience irritability too, where it is normally what doesn't get to you suddenly start to make you feel more irritable or get mad easier than usual. And a lot of times people experience muscle tension as well, where they feel more tight, like where they hold their anxiety or stress. Because when we're anxious, we're ready to tackle something, we're ready to fight something, or we're ready to do something. So our muscles are usually are prepared to do that. And so when we're always feeling anxious, our muscles can get tense and kind of hold that tension in as well. And then lastly, also the sleep disturbance, which could be difficulty falling or staying asleep. And usually that's the case with anxiety. But you can see that a lot of these, again, have that symptom overlap with stroke, and it has overlap with depression too. So a lot of times people may experience depression and anxiety at the same time too, if they have these worries that stays on for them, and then make it really hard to do the things that they usually enjoy doing. Then that's when the anxiety becomes more of that problem or barrier for people. Now, we've talked a lot about the different mood changes that can happen for people. There's another thing I wanted to point out for people after stroke. For some people, they may also experience this thing called pseudobulbaric effect. I'm sorry I butchered that. But what that means is that a lot of times their physical reaction that looks like emotional reaction does not match with their actual experience of emotions. So for example, that may look like suddenly start crying and then suddenly stop again, like that really rapid fluctuation of emotion, where it's sometimes people might not even know, why did I cry? Why did I suddenly cry or laugh or have that emotional reaction? That's not so much of my experience, but it just happens. And then kind of having questions about that, and other people might be a bit alarmed and say, oh, why did you suddenly cry or suddenly laugh? Like, what's going on? But it's hard because it at times can feel inappropriate. It could be a topic that's completely irrelevant to the mood that you are expressing, but then it doesn't feel like that's your actual experience. So that's sometimes that disconnect can happen too, and that is different from the actual mood changes that you experience with depression, anxiety, or adjustment reaction. Now, about 17% of stroke survivors do experience this, where they have that emotional expression, but may not necessarily feel like that's their actual experience of emotion. And about half of this over time can decrease, so that doesn't always stay on for everyone. But I just wanted to bring this to people's attention too, that this can be an experience for people too, where it's not the real emotional change, but more of that expression that comes on that just feels incongruent or different from your actual experience. All right, now that we finished talking about most of the mood changes, I want to talk about what we can do with those mood changes too. Now, even before talking about treatment, I want to mention a few ways that could be helpful to help with preventing mood problems or to help with coping. Now, first and foremost, and one of the big reasons that I think having this information is important is to be able to identify ways to help notice mood changes. Now, noticing some of those symptoms can be helpful. Sometimes that is the most important step for people, is to say, oh, why did I feel this certain way? Why did I have a lower mood when in the morning? Like, what came through, what went through my mind, what were some of the things going on? Even noticing that can help a lot of times, because then you can notice, oh, I see why I feel that way, because certain things happen and there can be changes. It could be problem solving type of thing, or it could be just addressing the emotion too. And that a lot of times helps a lot already. So that's why identifying the symptoms can be important, or just changes you've noticed. Now, another big thing is stress management. Now, stress management can help people by decreasing stress hormones, muscle tension, and help people feel more in control. So what that looks like could be really, when we think about stress, it is when you feel like what you have on your plate is more than what you can handle. So with that, there can be many ways to help with that stress management. It could be making sure that is more balanced in terms of you can delegate some of the things to other people, or you could increase the resources you have to balance that amount that you have on your plate versus the amount you have in terms of resources. So that stress management piece include identifying what stressors you have in your life right now, and maybe having it written down so you can see, okay, this is the amount I'm having right now. What are the resources I have that can help me go through these stress? And it could be self-care, it could be going to your social support, but really having a list of that can help with making sure you have that balance for stress. And the other big thing is social support. It can play an important role in your health and your well-being, having family or friends, having other people that can help you feel supported, whether that's emotionally, whether that's helping with that stress management piece as well. That's an important piece. And then I also want to talk about activation, which is being active, both physically as well as by being engaged in activities you enjoy, and interests and hobbies. And that can be really helpful in preventing mood problems from flaring up. And I wanted to also have a page on its own for physical activity, because it actually has a lot of positive impact on your mood and your health as well. And it can provide a complementary treatment for depression, and it can also, well, the way that it can help with depression is it helps regulate that stress pathway, which is the hypothalamic pituitary adrenal response, which is when our brain stimulates, when we sense that stressor, it sends that stress or sends signal so we can release the stress hormone. But the exercise can actually, or activity can actually help with that regulation. And kind of going back to that stress management piece as well, that's part of your resource. If you notice that you're feeling too stressed, the activity level can actually help bring up that resource, or feeling like you're having that bigger reservoir for coping with the stressful things in your life. And another reason that physical activity can be helpful is any activity, even if it's not extensive, and I encourage that it's not extensive at first, but to just engage in some sort of active activity can help that immediate experience of positive affect and help with bringing up your mood and feeling better. And it doesn't have to be a long exercise. And like I said, I encourage it's not long at first, because the more important thing is you're getting into some sort of activity and you're doing something that can help bring that positive affect and help with that stress management and help with your mood. And if it's so long that it's defeating at first, then there's no real benefit in mood in that aspect. And it can feel really hard to keep up with too. So I encourage even a small activity, something that keeps you physically active for a few minutes can be something that's helpful. And I wanted to bring that up as well. All right, now we want to talk about treatment for mood problems too. There are different ways that can help with the treatment, and this is more when we are experiencing depression and anxiety that are becoming harder for us to get to the things we want to get to. There are medications that can be helpful, like antidepressant or anxiety medication. What that does is help bring that mood to a more leveled part where you can feel like it's not as heavy, or it's not as pressing where it feels like you can't do anything at all. But it brings it up to a point that you can start engaging in different things like psychotherapy, like exercise or activity level, that it starts that cycle back where it can help you with kind of pushing or breaking that cycle of depression or anxiety. And actually, for medications, a lot of the SSRIs, or a group of the antidepressant like sertraline, can be very helpful for the motor recovery of stroke as well. So a lot of times, for some of the stroke, depends on which area, that the providers will prescribe the antidepressant medication just to help with both the motor recovery and also in terms of helping prevent from that mood risk as well, or risk factor for depression and anxiety. So it actually has multiple benefits on there. And psychotherapy can be individual or group, but usually what that is really identifying and working with people on different goals they have and what can be helpful for specific mood experiencing they're going through, and targeting different goals and helping with coping and mood regulation. And sometimes when people experience mood changes specific to situations in life, that could be something that's helpful in therapy to process through and problem solve, or talk about what are some of the tools that people can use to help in that situation. And then support groups, which people are here joining, and peer support groups, people probably who are here already find the benefit of it. It can be a great place to connect with other people who have similar experience and understand the impact it can have on mood and other aspects of life. And I also find that with support groups, oftentimes other people's experience and journey can give me more ideas of, oh, this is what I might expect, and this is something that could potentially be helpful for me too when I hear from other people's experience. So it's a great way to have that support and additional coping tool. And most of the people, they could try one of these or a combination of different approaches. And oftentimes people find it helpful to have different approaches together to help them in different aspects. So that's more of the treatment aspect. And lastly, I wanted to touch on resilience, because I also want to point out how the positive mood reactions can shape how you feel. Now, research has shown that a lot of people not only live through, but actually thrive in the face of adversity, trauma, tragedy, difficulties, or losses. Now, what resilience is it's this process of adapting or bouncing back from significant changes. And that can involve the ability to maintain or experience emotional well-being and functioning with those changes and difficulties that are there. But what it doesn't mean is, it doesn't mean that you will not experience difficulties or discouragement or difficult emotions, because like I said, there are ups and downs, and that's what we do as humans. But what it means is that we are able to have those emotions and still continue on with activities and relationships or goals that are important to us, despite having those emotions that can be difficult. And there are a lot of people who show resilience in the face of difficult situations and changes. So I wanted to point that out too. And lastly, I wanted to summarize what we've talked about so far. So stroke can be associated with a bunch of mood changes, including anxiety and depression. And in preventing these depressed mood and anxiety to come in the way, stress management, social support, and activation are important. There are a number of treatments available too for depression and anxiety, including therapy, medication, support groups. And it's important to be aware of the changes you experience in your mood and to bring it to your healthcare provider if you notice changes that are concerning, so they can help identify if these changes are there are ways or treatments or ways to help with these changes and develop a plan for treatment if needed. And lastly, I wanted to talk about this resource that was found, or I found. It's from the American Stroke Association. There's a series of podcasts that talk about COVID-19 and its impact on stroke survivors. And they kind of touch on the emotional well-being, the staying active at home, and overcoming unexpected financial changes and stroke rehab during COVID. So I find that this is probably a series that could feel a bit relevant to now, so I wanted to mention it. And if you have iPhones and have smartphones that has podcasts on them, you can search on that too to find this series, or you can go to the website, I believe, to find that series as well for more information. I wanted to share this resource with you guys too. And now I am open to questions.